Warning: the use of drugs can be very dangerous and have devastating consequences if not used properly. Do not try any drug unless directed to by your doctor.
Hello, my name is Maxwell Klonsky. On today's episode of the Drug Slide, we will be examining the very important drug anesthesia, which can be applied locally to numb a small part of the body, or generally, to cause induced unconsciousness in a patient for a controlled period of time. Throughout the course of this episode, we will be examining the structure, function, applications, advantages, and disadvantages of the use of the drug in both recreational and medicinal settings. Throughout recorded history, many great civilizations tried and failed at creating an effective anesthetic. Even during the Middle Ages, when medicine advanced in leaps and bounds, it wasn't until the 19th century when anesthetics really experienced a breakthrough. After being refined in the 20th century, anesthetics cemented their place as an important tool in surgeries across the globe, and also allowed for surgeries to become more advanced as well. Without anesthesia, many surgeries that happen daily, sometimes even life-saving, would be impossible due to the pain experienced by patients. Although anesthesia is just a tool in a more complicated process, it's important to not be understated, as these surgeries would be impossible without it. I have set up a meeting with acclaimed anesthesiologist Dr. Tory Hunter. Since graduating from Johns Hopkins Medical School in 2002, Hunter has been a stalwart in the anesthetic field and is considered to be one of the leaders. Let's go meet him. Dr. Hunter?
Maxwell, thanks for having me on the show today.
Thank you for coming. It's an honor.
Maxwell, I'm honored to finally meet one of my favorite TV celebrities.
The honor is mine. It's not every day I can learn from one of the best and brightest in such an important field such as anesthetics.
Anytime. Thanks for having me on the show.
No, thank you. What are you working on?
Oh, work stuff. Right now I'm just finishing up an article for the Scientific American on local and general anesthetics.
Well, you certainly are busy, so thanks again for making time for us. Actually, now that you mention it, I have some questions about local and general anesthetics. As I understand it, local anesthetics are more of a numbing agent, while general anesthetics induce unconsciousness.
It sounds like you have a pretty good understanding of them. Local anesthetics are much like their name implies, local. They're injected directly into the site of pain. A few examples of these are lidocaine and bupivacaine. The use of general anesthetics also can be implied by their name. They're general. They work on the entire body and often induce unconsciousness in complicated procedures such as surgeries.
Okay, great. Thanks so much. So I'm a little confused. So it sounds like the difference between local and general anesthetics is more in their applications, correct?
Anesthetics like lidocaine have a very specific structure that can help with its function. They are composed of 3 parts: a lipophilic aromatic ring, an intermediate ester or amide chain, and a terminal amine. Each serves a very specific part in the action of an anesthetic.
Interesting. Okay, so what do those different chemical structures do to aid the function of the anesthetic?
It is actually quite simple. The more fat-soluble the aromatic ring, the easier it is absorbed into the body, making that particular anesthetic stronger. It makes it much easier for the drug to enter the neurons, which stops the influx of sodium ions, inhibiting neural conduction, stopping the pain in that specific location. The other part of this is the terminal amine group, which helps with the overall conduction block formed by this kind of drug. The goal of an anesthetic is to bind to a plasma protein to block nerve impulses to the patient's brain. This stops the pain signals.
So I hear that there's another use for these local anesthetics. Many doctors use them for numbing large parts of the body all at once without putting you completely unconscious. For example, numbing a whole limb, such as my arm. Could you clarify that for me? Is there anything you'd like to...
Yes, that is correct. These are called regional anesthetics. They are the same thing as local anesthetics, but they are injected directly into the nerve to stop the pain in that whole region of the body.
That's so interesting. So I'm sure that you're very well versed in the topic of the general anesthetic, the drug used during surgical procedures to create unconsciousness. We've been talking about that a little bit. And would you mind telling us a little bit more about it? Because I'm still a little confused.
Of course! General anesthetics are mostly used in surgical and dental procedures. They are often administered intravenously and also through inhaled gases. In the cases of surgical anesthesia, it creates unconsciousness to the point where the muscles and all other bodily functions relax, except for the heart, which often needs to be controlled by other drugs because these general anesthetics are known to cause an irregular heartbeat in many cases. The action of general anesthetics involves the modulation of the GABAA receptor, which is the fastest neurotransmitter in the central nervous system.
Thank you again, Dr. Hunter. Now, we'd like to introduce Jesse Pinkman, a longtime anesthesia drug addict, unfortunately.
Hi. Where am I?
You're on the set of A Drug's Life. We'd just like to ask you a couple questions about your experiences with anesthetics.
Drugs? You got drugs?
No, Jesse, we don't have drugs here. Just sit down. We'd like to talk to you. Okay, great. Good to have you on the set, Jesse. Now, I understand that you've been a drug addict for a number of years now. How did you first get addicted to anesthetics?
Well, my friend hooked me up with some ketamine for my birthday. I've loved it ever since.
Wow, that's very interesting. So, why exactly is the recreational use of anesthetics so appealing to you?
Yeah, I don't really know. I mean, I guess it helps me cope with the pain that comes from the underground fight club that I participate in. But you know, it's like, you get hit, break a bone, just take some anesthetics, and it's like as if you never broke your bone. And, I don't know, it's helped me kind of live through that pain. I like to think that that's kind of how Lord Voldemort was able to survive for so long, until Harry took him down.
You know, I've actually never heard it put that way. That's a very interesting way to put it.
Yeah.
Have you noticed, I'm sure, have you noticed any adverse side effects of using anesthetics, also known as contraindications?
I mean, nothing that big. Sometimes though, I can't really remember what happened before I used the anesthetics. It's kind of weird feeling. One time I lost my tooth, but I found it, put it back in. It's all good now. I don't have any more feeling in my left foot. But the sensation is the loss of sensation. It's slowly climbing up my leg.
Wow.
But not that big of a deal.
That sounds I'm sorry. That sounds very uncomfortable, actually.
Yeah.
Well, do you know what happened? I'm curious.
Yeah. One day I was going to the grocery store, and I stubbed my toe, and it hurt real bad. So now I just took some drugs, took some anesthetics, and
Do you remember what type? Was it ketamine? Was it?
Man, probably. I don't really know though. I just injected my toe. The pain stopped for sure. Man, I haven't had any pain felt there in years now. So it's really done its job.
Well, Jesse, we'd like to introduce you to Dr. Tori Hunter. Dr. Hunter, Jesse, Dr. Hunter. Dr. Hunter, do you have any questions, as Dr. Hunter is an expert in the anesthesia field? Do you have any questions, Dr. Hunter, for Jesse?
Yeah, I was actually wondering, why are you wearing that eye patch?
Yeah, I was wondering the same thing. Why do you have that eye patch on?
I guess one day I just couldn't see out of my left eye anymore. I don't know.
So, you just randomly lost your vision?
Yeah, I don't know why. I don't know how.
You realize that is one of the most common contraindications from bad use of anesthetics.
Well, so, as you can see, the contraindications...
Okay. When are the drugs coming?
Jesse, there are no drugs in the set of A Drug's Life.
What?
There are no drugs on our set.
You said,
I said
Sir,
no such thing.
that there would be drugs.
Jesse, I think we might be done here. There are no drugs on our set.
We are done here.
Well, it looks like this is a good concluding point. Dr. Hunter, I'd like to thank you again for coming in and talking. We really appreciated your time. As you've learned, anesthetics are a very valuable tool in procedures such as surgery, as they numb pain, and they can be used generally and locally. However, when abused, anesthetics have some very negative consequences. Thank you.